So this is a demonstration for a female pellet insertion for testosterone. And testosterone in female is very important for quality of life. It protects your heart, your brain. It also helps you build muscle and increase your libido, and also have fat loss as well. So it's a game changer, especially for women that are about probably 50 or over, that are either perimenopause or in post-menopause. And a procedure before I do it, what I do is I look at how much fat is in the buttock area, and it's usually, we just put the pellet, and you can see the camera right here, and if you can see, it's an ultrasound machine, and I put it there so that way I see how many inches of fat there are. But what I do is I insert in the pellet, which is like the size of a Tic Tac. So bring it over here, and you can see this here. It's the size of a Tic Tac, and we just put it just underneath the skin, and it's buried in the fat region. And by doing that, I know how much depth it is. I know how much depth. I can put the pellet in, so it's safe, and there's no risk of extrusion or it coming out. It's minimal risk of it coming to the surface, and also minimal risk of infection as well, or even pain. So now this area has been sterilized already, so we're just gonna do a little poke here for to numb the area. So I marked the area, so I'm gonna numb the area, and then I'm gonna and numbing it, we inject in lidocaine with a little bit of epinephrine, so there's minimal bleeding, and then also with sodium bicarb for less of a burn as well. And the key is to know where to put it in, so that way it sits in the right spot, and that's why we use the ultrasound. Can I have some Alright, so we're all sterile now, so we're gonna sterilize the area here. And then that will allow time for the anesthetic to soak. And then instead of, most people uses a scalpel, I don't. So the scalpel cut and it creates a scar, and sometimes it can bleed and it creates a bigger hole than is needed. So I do not use a scalpel. I use actually the edge, the bevel edge of the needle, to make just a small opening, enough so that way the trocar for the pellet can go in. And for women, luckily the trocar for the pellet is small and does not need to be big. So by doing this, by using the bevel of the needle to make the incision, my patient do not have a scar. They just have a little brown dot, and there is no large scar at all. So aesthetically it looks very pleasing. And so this is a trocar where we will be putting in the pellet into. So then now that I know the depth, I know what the safety depth is, and it's it already. And this is the pellet here, so testosterone, 100 milligram here. So it's about the size of a Tic Tac, and this is 12 milligrams. You push that through the opening of the hole, and then you push it through, and it's in there. And now we take it out, and it's already in there. And so afterward we put pressure on the area for 5 minutes to stop any type of possible bleeding. Usually there isn't any because there's no trauma, there's no cut. And the main thing is I do not use a scalpel. I do not believe that you need a scalpel because it traumatizes the skin and the area. And then we put 2 dressing on it. One is a dressing with the steri strip, which covers the hole and keep the pellets in there, and also help the small incision heal. And this stays on for 5 days. And then we do a gauze dressing that's on top that is pressurized, and that stays on for 24 hours. And the aftercare is that the main thing is that no exercise involving the legs, like high impact, like running or weight training or doing squat, at least for women, for 3 days, and for men is 5 days. And this is only so that way there's no swelling of the area and the pellet doesn't come out most of the time. Other than that, this is how we do the pellets. Are different than others by using the ultrasound machine to find the depth of the area to go into, so it's safe. And also we don't use a scalpel. We do extensive blood work beforehand to evaluate if a person is a candidate for testosterone pellet therapy. For women, I usually start with the testosterone, and then I may add some estrogen or progesterone later if needed, depending on her symptom. I treat patients for their symptom, not what their blood work are showing. All right, so that's it for pellet today. All right, so just a little aftercare about the pellets is that one of my patients asked a great question: what happened to the pellet? Well, once the pellets are placed in there for women, every 3 months they get it again. And the pellet dissolves because it's bioidentical and it's organic, and your body just absorbs it. And the good thing about the pellet is that it goes straight, when I insert it into the fat area, it goes straight into your bloodstream, and bypassing the liver and the kidney. So it goes straight to your cell, to your cell that does all the work, the powerhouse of your body, without having to go to the liver or the kidney at all. So that means that you have less side effects and that you get the testosterone in its original state. And again, it's bioidentical, which is different than if you're going to inject yourself with testosterone. Now, if you're injecting yourself with testosterone, that bottle of testosterone is made in the lab. When it's made in the lab, it's synthetic, and it's in a form that your body does not recognize. So when you inject it with testosterone, it has to go through your bloodstream, goes to the liver has to convert it to a form it recognizes, so that way your cells in your body can use it. So by doing pellet, you're bypassing all that. You're giving yourself what it needs to function with the testosterone. Okay, well, thank you.